And now I have the privilege of introducing our first speaker, American Academy of Pediatrics President, Dr. Benard Dreyer. Dr. Dreyer is a general and developmental behavioral pediatrician who has spent his professional lifetime serving poor children and families. In addition to being a professor of pediatrics at NYU, Benard leads their Division of Developmental and Behavioral Pediatrics and also serves as Director of Pediatrics at Bellevue Hospital. For over 30 years, he led a primary care program at Bellevue, including co-located mental and oral health services and clinics in homeless shelters. Dr. Dreyer has been an active leader of New York Chapter 3, as well as a member of the AAP Committee on Pediatric Research and the Executive Committee of the Council on Communications and Media. He co-chaired the AAP Health Literacy Project Advisory Committee and serves on the Executive Committee of the Section on LGBT Health and Wellness and the AAP Leadership Work Group on Poverty and Child Health. Dr. Dreyer is president of the Academic Pediatric Association and founded and chairs the APA Task Force on Childhood Poverty and the APA Research Scholars Program. Please join me in welcoming our president, Dr. Benard Dreyer.
Great to be here talking to you today. The English translation of a purported ancient Chinese curse is, "May you always live in interesting times." Well, we certainly do. I think we can all agree that this past year has broken records on that account. The curse, however, turns out to be apocryphal. No such Chinese saying has ever been found. The closest Mandarin expression is Ning Wei Tai Ping Chuan, Mo Zuo Luan Il Chen, which translates to, better to be a dog in a peaceful time than to be a human in a chaotic period. Which may describe what our lives are like today. Though even in the midst of chaos and confusion, I'd rather be a human than a dog. There are days when I think it might be time to reconsider. And on those days, when I need a dose of reassurance or inspiration, I reread our mission statement: to attain optimal physical, mental, social health, and well-being for all infants, children, adolescents, and young adults. Note, it doesn't say optimal health for some children, but rather for all children. Today, I will focus my remarks on what I think we mean by all children and how we've helped those children attain optimal physical, mental, and social health this past year. Let's start with the AAP Agenda for Children, which has been at the heart of our mission since our founding in 1930. The agenda's latest strategic priority, child poverty, is the most serious non-communicable disease facing children in the United States today. Children are poorer than any other group, and child poverty is everywhere: inner cities, rural America, and even the suburbs, which have seen the fastest growing increase in poverty. An AAP survey of pediatricians revealed that on average, 48% of the children they care for are poor or in financial distress. On March 9th, we released a policy statement on poverty and child health, and I was interviewed by 24 media outlets that day, and a question that kept coming up was, why do pediatricians care about child poverty? The answer was simple. Nearly half of our patients are poor or near poor, and we care about their mental and social well-being as well as their physical health. We care about children's futures and don't want to see them potentially trapped in unproductive, unhealthy lives and intergenerational poverty. We care about all children. That policy was extraordinarily well received by our members, most of whom said reading it made them proud to be part of the Academy and proud to be a pediatrician. It brought us to the table of many discussions about how to solve these critical problems. and set for us an agenda for advocacy which underlies many existing problems we care about. Food insecurity, health inequity, early brain and child development, environmental risks like the lead toxicity seen in Flint, Michigan, toxic stress, chronic diseases like asthma, family homelessness, and immigrant child health. To solve any and all of these problems, we need to do something about child poverty. Many of our members have already been screening for basic needs in their practices and clinics and helping connect families to community resources. But the Poverty Statement and Technical Report, the resources on aap.org/poverty, Healthy People 2020 grants, and chapter-level collaborations have made this more explicit and easier to do. In pediatric clinics and waiting rooms, anti-poverty initiatives of individual pediatricians are making a real difference for poor children. When I started talking about child poverty in 2012, good-intentioned pediatricians would say, "Of course I want to do something about child poverty, but what can I do? It's too big a problem." Fortunately, that's not the case, and we have realistic solutions that we know work. Existing federal policies do work. Without them, millions more children would be poor. Most other high-resource countries, including Canada, the UK, and much of Europe, have policies that keep children out of poverty. The UK cut child poverty in half in 10 years and serves as a model for what we can do. Last year, the US Congress voted to fund the National Academy of Medicine to study and come up with a plan to cut child poverty in half in this country in 10 years. And 2 weeks ago, I met with a small group of experts at the National Academy of Medicine to plan out that study, which is scheduled to begin in January. Of course, it's a heavy lift to go from a National Academy of Medicine report to actions in Congress. But it will be awfully hard for Congress to ignore a report it asked for. In the meantime, the AAP will continue to strengthen our advocacy for government policies that support and expand essential benefits programs such as Medicaid, CHIP, and nutritional support, that support and extend strategies promoting employment and increasing parental incomes, that improve communities, including the availability of affordable housing, that invest in young children, and that support better parenting, including home visiting and reach out and read. My life's work has been caring for immigrant children and families in Bellevue Hospital in New York City. So the recent extraordinary increase in unaccompanied minors and families fleeing the violence and murder in Central America is personal for me. In addition, you may know that my parents both immigrated to the US from Eastern Europe. My mother was an orphan and came to this country as an unaccompanied 12-year-old girl, fleeing violence and traveling across the Atlantic all by herself after being separated from her brother, who at age 16 was too old to be allowed into this country. She cried herself to sleep every night in her steerage class bed on the ocean liner that brought her to Ellis Island. And while my mother and father came here legally, my beloved aunt and uncle were undocumented immigrants. Aunt Ray snuck into the US from Canada, and Uncle Eber after many unsuccessful attempts on a banana boat from Cuba. But they were the most wonderful people and contributed richly to this country. So hearing about the children from Central America crossing our border, fleeing violence, undocumented and alone, looking for family and a safe haven, resonates deeply in my heart. I am proud that the AAP has led the way in advocating for the needs of these families and children, and gratified that I could be a part of that effort. We deserve that applause. I want to specifically give a shout out, however, to the work of the Council on Community Pediatrics Special Interest Group on Immigrant Child Health. to the AAP Department of Community Chapter and State Affairs, to the Texas Chapter and Pediatrics Society, and to the many wonderful pediatrician heroes on the border and throughout the country. Through them, the AAP has worked with both the Office of Refugee Resettlement and the Department of Homeland Security to ensure these children and families are treated justly and humanely. Last month, I stepped on that with applause, huh? Last month, a group of us, you can see us there, visited the Texas border to see firsthand how unaccompanied minors were treated in ORR facilities and how families were treated as they came across the border. Perhaps the most heart-rending part of the trip was our visit to the Sacred Heart Catholic Church Respite Center in Mcallen, Texas. Here we met families who were being released to their family sponsors across the U.S. because the ICE family detention centers were full. They had journeyed for months to escape the carnage of Central America, coming across Mexico, crossing the Rio Grande into Texas, and then giving themselves up. They'd spent days in processing centers and were tired, dirty, and bewildered. And all the adults were wearing heavy ankle monitors as a condition of release. Sacred Heart arranges for these families to get a shower, clean clothes, and a hot meal before they journey to their waiting sponsors. And while there, we helped out, feeding the families, finding them clothes, examining children with fever, and showing them loving kindness. I will never forget the gratitude and relief on their faces. They had tears in their eyes, and so did we, and so do I now. This is a picture of one beautiful family I was assigned to, and that's 10-year-old Edgar with the big smile. If these families are allowed to stay, I know they will add to the richness and fabric of our country. But our efforts do not stop here. We're actually going back to the border next month to witness the conditions the families and unaccompanied children experience in the Border Patrol processing centers. The AAP has also been part of a Homeland Security Advisory Committee that's making recommendations about the family detention centers. The committee just released its report, which recommends DHS discontinue the general use of family detention. Saying detention is generally neither appropriate or necessary for families, and never in the best interest of children. AAP's Immigrant Child Health Special Interest Group is finishing up a new policy to delineate the Academy's position on the treatment of unaccompanied minors and families, and our members are alerting us to new problems we need to address. We will continue to focus on these vulnerable children and their families who are so important to the future of our nation. We do this because we care about all children. Let me briefly touch upon two other groups of children before concluding my remarks. First, are LGBT children, youth, and parents. The AAP has a long history of support for these groups. In fact, we often had to wait for the public to catch up with us. This year, we focused particularly on transgender children. In April, the North Carolina chapter and national AAP called for repeal of North Carolina's so-called bathroom bill that denies transgender students access to gender-segregated spaces in school. In September, we signed on as a sponsor of the Human Rights Campaign's Guidelines for Caring for Transgender Children. And in the August issue of AAP News, I addressed how we as pediatricians should support families and children on the continuum of transgender. I received more positive feedback from pediatricians for that letter than any other letter I wrote this year. Why? Because we care about all children. I also want to touch on our work internationally. All children means we care about children everywhere. A lot of our work internationally comes through our members on the section on International Child Health and our Department of International Child Health. I especially want to call out our global immunization initiatives and our Helping Babies Breathe and Helping Babies Survive efforts. We're also very much involved in UN and UNICEF initiatives, especially the new Sustainable Development Goals. It was my privilege to talk about the interventions to improve early brain development in primary care at the UNICEF Conference on Early Child Development in Morocco last month. There, representatives from low and medium resource countries from the Middle East and Africa gathered to develop an agenda they could take back home to improve access to parenting programs and early childhood education in their countries. Major advances have been made in decreasing childhood morbidity and mortality across the developing world, and we have played an important role in this progress. The war in the Middle East and the breakdown of civil society there has led to death and suffering of many children and created the largest refugee problem since World War II. And that's a problem we can't just solve ourselves, obviously, but our Friends of Children Fund provided funding to help train pediatricians in Turkey, Jordan, and Lebanon to treat the psychological and medical needs of Syrian refugee children streaming into their countries. We've also been supporting the International Pediatric Association's Protect Children of War campaign, a petition to the UN to protect children in war zones. Indeed, we care about all children. When Brazil reported 4,000 cases of babies born with microcephaly between October 2015 and January 2016, the AAP joined forces with the CDC to develop guidance and resources to help clinicians care for children of women exposed to Zika virus during pregnancy, obviously from mosquito bites. The CDC and U.S. Department of Health and Human Services has since awarded the AAP a total of $800,000 to help primary care providers and other pediatric clinicians implement that guidance through the medical home. In addition, the AAP Friends of Children Fund made a grant to our Puerto Rico chapter to help its pediatricians respond to the Zika virus. We have been working closely with Chapter President Fernando Isern to protect the children of Puerto Rico from Zika. We do this because we care about all children. Circling back to the beginning and the so-called Chinese curse, may you always live in interesting times, it has been especially interesting to be the AAP president in this election year. Though this election season sometimes feels more like a circus or cage match than a campaign, it is nevertheless a great opportunity to help children. For the first time in 8 years, we will have a new administration, and there's a lot at stake for children and families. I'm particularly excited about our Blueprint for Children, a groundbreaking document that outlines what the AAP thinks the administration and Congress should do to build a foundation for a healthy future and improve the lives of children and families. Of course, all the children I've been talking about today are featured in that blueprint, but the blueprint goes much further and lays out the administrative and legislative agenda for all children, rich or poor, as well as the needs of pediatricians. It's already being used by government agencies to prepare their transition plans for the next administration. I want to end with two messages, one to children and one to pediatricians. To children, I want to quote from a book that has been a staple in my family since the 1970s, Free to Be, You and Me by Marlo Thomas. I would like to remind you children that you are the hero of your own adventure and that you can write your story any way that you dream it can be. In other words, you're free to be whomever you want to be. And it's our job as pediatricians to help you accomplish that awesome task. My beloved wife, Constance, and I would say that to our own children as they grew up and thrived. And now I say it to my two granddaughters, Adeline and Alma. Adeline, Alma, my children, Demetra and Derek, and their families are in the audience today. I love you all very much. Oh, how I wish your mother was here with us today. This was a journey she wanted to take with us so very much. Finally, to pediatricians, I want to share a story. Until 2,000 years ago, the Jewish religion revolved around the temple in Jerusalem. And then in 70 AD, the Jews revolted against the Roman Empire, and the Romans destroyed the temple. On seeing the temple in ruins, one of the rabbis cried out, "Woe unto us! How will we be able to atone for our sins, since the temple is the place where we did this, and it now lays in waste?" Rabbi Yochanan, the sage who is credited with keeping Judaism alive during this difficult period, answered, "Do not be grieved. We have another atonement, as effective as this. It is acts of loving kindness." So I salute you, my fellow pediatricians, for the acts of loving kindness you perform for children and families every day. You atone for the sins of others, and you move us a step closer to a more perfect world. My good friend Peter Szilagyi, who is a pediatrician and AAP fellow, ends all his communications with, "Remember, it is all about children." I will borrow that ending from him and add to it. Remember, it is all about all the children. We are their pediatricians, and we care for and about all children. Thank you for your friendship and support during the good times and the interesting times. It is my honor to serve you. And now it's time to present the 2016 American Academy of Pediatrics Education Award. Education is a crucial piece of the foundation upon which our Academy was built. This year's winner is Dr. Janet Serwint, Professor of Pediatrics, Vice Chair of Education, and Residency Program Director for Pediatrics at Johns Hopkins University School of Medicine. And an old and good friend of mine. We were reminiscing in the green room in the back. And she's also former president of the AAP Maryland chapter. Over the course of her impressive career, Dr. Serwint has had a powerful and far-reaching influence across the continuum of pediatric medical education. Dr. Serwint received her medical degree from Northwestern University Medical School and her pediatric residency training at the Children's Hospital of Los Angeles and Indiana University's Raleigh Children's Hospital. Her career in medical education began at Indiana University with her role as co-director for the Indiana statewide educational program on sexual abuse. As president of the American Academy Academic Pediatric Association, Dr. Serwint led the development of a remarkable resident curriculum on resilience in the face of grief and loss. And one cannot overstate the national impact of her work as director for the Continuity Research Network, or CORNET, which has produced groundbreaking research in primary care, healthcare delivery, medical education, and has touched healthcare practitioners, trainees, parents, and families alike. Janet's accomplishments as a pediatrics educator are important, sustained, and remarkable, and not only as a leader, but as an innovator. And also, most importantly, as a treasured mentor to many students, resident, and junior faculty. For me, this is a wonderful experience because I have a close and long-standing personal relationship with Janet. I have valued her mentorship and her friendship and her love for many years. So please join me in congratulating our 2016 American Academy of Pediatrics Education Award winner, Dr. Janet Serwint.